welcome to
Thank you.
HITLAB's 2023 Summit. Who am I with today? What's your name, title, and organization?
Great. So I'm Meg Baron. I lead digital health and innovation for American Medical Association.
All right, great. Well, Meg, thank you so much for joining me today.
course.
Is this your first summit, or have you been to these in
I've
the past?
had the opportunity to participate in multiple summits, but they've all been virtual to date. So it's really nice to be back and be live here in person.
Yeah, absolutely. So welcome back.
Thanks.
Can you talk to me a little bit about AMA and your role there?
Sure. Yeah. So at the highest level, what myself and our team is really focused on is how do we help to make technology an asset versus just one more burden on the plates of physicians and members of the care team and ultimately patients. And physician burnout is at an all-time high right now, but also the need for technology to help address a lot of those administrative purposes is extremely high, or the need for that is extremely high. So our team really focuses on both research at a national view to look at where there are gaps in terms of both evidence for digital health, as well as what's the necessary components for adoption and implementation to really stick. And then how do we help to get implementation and adoption for evidence-based and trusted solutions?
Yeah, absolutely. That's so important. The relationship between health tech and physicians, the people who are using it,
Exactly.
is so important. So I was wondering, what are the major factors that cause physicians to maybe be deterred from new innovative technologies, and what do you do to make sure that that adoption is a little bit more seamless?
Yeah. So we've done benchmark digital health research dating back to 2016, again, that we released in right around the time of COVID, actually, and then again in 2022. And the good news is physicians are very open-minded and want technology to help them really address a lot of these administrative issues. But they also are very clear on the key requirements that they have, or that have to be there for adoption to really stick. And those are around, prove to me that there's an evidence base or ample evidence for me to use this or prescribe this in my practice. Reimbursement needs to be there, and fair payment, right, needs to be there. Liability coverage, so especially for things like data privacy and data security, that they need to feel a level of confidence before they're going to introduce that to a patient. And then lastly, and what often can be the most difficult, is just around the change management of introducing one net new thing into a very overburdened workflow already. So we help to provide a lot of resources, tools, playbooks, et cetera, on those various topics to help to get at what are best practices really being seen across the country in those different areas.
Yeah, absolutely. So you mentioned that you've been working in digital health since 2016. So obviously since then the pandemic's happened.
Right.
How do you think that's impacted a physician's willingness and ability to adopt digital health, and where do you see it going from there?
I think, as we've all kind of heard and talked about, it's really been a silver lining of the pandemic, if you can attempt to glimmer anything there. But of course, you know, a lot of these technologies and tools, think remote patient monitoring, think e-visits and telehealth, have been available for years and years. But when you think of those key requirements, especially around reimbursement and some of those other components, those just hadn't been in place before. So this really, you know, provided an opportunity for these technologies to be pushed mainstream. I think moving forward in a post-pandemic environment, that's where, for these to be sustainable, those key requirements still have to be met. And now it's more, how do you optimize in-person and virtual care and really attempt to get at right care, right time, right modality of care for the right patient.
Yeah, absolutely. So do you think that kind of this integration of digital health will affect accessibility in the healthcare industry at all?
Yeah, well, our hope, and we've done some things like a return on health value framework that we've looked at to really take a wider view on how value is being created in regard to the rollout and adoption of new technologies and tools. So for instance, for telehealth and virtual care, this framework really helps to look at, beyond just short-term financial ROI, how are improvements being seen for patient access, for health equity, for patient satisfaction and physician satisfaction, and then ultimately for improved outcomes. And these have been very powerful as case studies and use cases at a national level, one, to help people understand as a blueprint what they could attempt to integrate into their own practice environments, but two, from a policy standpoint in terms of reimbursement and anything regulatory to help make the case of where value is being seen comprehensively.
Yeah, absolutely. So I understand that you were invited to be a guest speaker at the summit. Can you talk a little bit about what you were talking about, what you want the audience to take away from it?
Yeah, so we were able to touch on a lot of what I was just mentioning through our fireside chat, but at the highest level, where we're focused next is back to that sustainability and really optimization of how do we get to improved health outcomes by utilizing technology in the right way, and how do we help to ensure that those key requirements that physicians have are met and addressed for technology to really be best suited to be successful. And I think that starts as early as concept stage for new companies and innovators. So the fact that HITLAB's putting on this Innovator Summit to really help bridge those worlds is definitely a step in the right direction.
Yeah, absolutely. So I was wondering if you see, as you're trying to integrate health tech, what part, this is a very broad question, but what part of the healthcare industry do you think needs the most intervention? And what do you think, where do you think health tech could make the most impact?
Sure. Yeah, I mean, listen, the good and bad news is there's so much opportunity for improvement across multiple different categories, right?
Yeah.
But if I had to pick, of course, areas like chronic disease, right? And the fact that you've also got an aging population and that workforce-wise, we're really going to have to lean on technology, like it or not, to be able to help to address the patients in different communities that will need care. So to that regard, again, so much opportunity on the table.
Of course.
Being able to think about the most marginalized of both patients as well as marginalized, physicians or in different pockets to help to ensure diverse perspectives are included as early stage as possible, I think is also essential to help ensure that we make improvements versus work backwards.
Right. Yeah, I couldn't agree more. Meg, thank you so much for chatting with me and for answering all my questions. I really appreciate it.
Of course.
Thanks.